the Family Medicine Handbook, and it describes clinical governance as a framework that helps managers and clinicians, such as nurses, doctors, and physiotherapists, to improve the quality of their services and safeguard standards of care continuously, thoughtfully, and in a coordinated fashion by creating an environment in which excellence in clinical care will flourish. So what does this actually mean? Oh. Okay, so the key points are that clinical governance is an umbrella term. It encompasses everything that assists in maintaining and improving high standards of patient care. So every healthcare professional is aware of their role in providing high quality of care. And then it also can involve quality improvement activities. Lindsay will also chat about this later on in the QIPs as well. So this, for example, this could be a patient satisfaction survey, developing and distributing evidence-based guidelines, auditing of antenatal cards, and perinatal review meetings. With clinical governance, you also want to identify what works as well as what does not work, and therefore taking action appropriately. So you want to also commend healthcare workers on their good practice, as well as provide constructive criticism, and involves a lot of problem solving in clinics. So these are our four main key roles of clinical governance and the characteristics. So it deals with clinical effectiveness, patient safety, continuing professional development, and is a patient focus. For clinical effectiveness, this is where you practice evidence-informed practice using the clinical guidelines that our government provides us with, and clinical audit. Lindsay will also touch on clinical audit later. This is where you measure the quality of care given against the standards of care. Patient safety includes risk management, where you identify risks and you take action to avoid them. So these could include the M&M meetings that we have, our infection control meetings, and performance reviews. And you also deal with adverse events. For patient focus, you can have a complaints box at your district level care. You can have patient information leaflets and patient involvement. You want to make sure it's patient-centered. And then continuing of professional development. This is for healthcare workers to make sure they're kept up to date. The concept of spiral learning, continuing your learning throughout your career, multidisciplinary activities, journal clubs, things like that, and feedback and performance reviews. So this is basically the 4 key aspects of the framework for clinical governance. Cool. Why do we need clinical governance? So we need clinical governance to ensure that good quality care and an equal standard of care is maintained across health facilities. In the handbook, it speaks about how in different parts of South Africa, whether you're accessing a clinic in an urban, well-resourced area or in a rural setting, whether it's tertiary, district care, or primary level, we want to make sure that every single department and facility has offers our patients an equal standard of care and good quality care. And for this, we need clinical governance. So healthcare professionals have a duty to serve their community, provide quality care. It speaks about accountability, able to provide evidence that standards of care are maintained, and a lot of reflection. So healthcare professionals are able to reflect on their achievements as well as their pitfalls, and brainstorm new ideas and how we can make improvements about that. So the whole handbook is based for district clinical specialist teams, so we can look into what those are as well, and who's involved in a district clinical specialist team as well. But they're the ones who drive this clinical governance at primary healthcare facilities. And then through stakeholder involvement, we can allow for sustainable clinical governance programs and activities. And then Lindsay is going to carry on talking about the national core standards as well as clinical effectiveness and touch on clinical audit. And then Claire will take over and talk about the monitoring and evaluation.
Okay, so we have national core standards that work as a tool for clinical governance. They create an environment that enables quality improvement and were developed in 2011 by the Office of Health Standards Compliance. There are 7 domains of the national core standards, namely patient rights, patient safety, clinical governance, clinical support services, public health, leadership and corporate governance, operational management, and facilities and infrastructure. These 4 key areas define the purpose of the national core standards. As mentioned previously, they provide an environment that promotes clinical governance. These 4 key areas then are providing a common definition of quality of healthcare, providing a national benchmark for quality care, providing a common tool for managers to assess their staff and clinic, and providing a framework for the assessment of health facilities. Clinical effectiveness is one of the major role players in clinical governance. It is defined by the 5 R's. Right care provided to the patient, the right patient, one who's informed about their condition and involved in decision-making, the right time, the right clinician, with the right skills and the right way. The 3 components of clinical effectiveness are evidence-informed practice, clinical guidelines, and clinical auditing. These 3 components tie in together to feed back into clinical governance. In order to adequately assess clinical governance, the 3 components of clinical effectiveness need to be critiqued, i.e., lack of implementation of clinical guidelines on the ground will lead to diminished clinical governance. Guidelines, especially new guidelines, can be difficult to find online. And if needed in an emergency setting, healthcare workers will actually revert back to tried and tested knowledge instead of taking time to look for a new guideline. Moreover, guidelines do not take into account challenges faced on a daily basis on the ground, especially in primary healthcare facilities, such as resource challenges, understaffing, and a high patient load. All of this needs to be taken into account when assessing clinical effectiveness, as this will decrease clinical governance. A clinical audit can be used to assess aspects of clinical governance. The clinical audit is a key player in clinical governance, as it's an objective measure of the quality of patient care. A clinical audit is a quality improvement process, as Mel mentioned earlier. It uses preset criteria and is ongoing. If needed, a change should be implemented during the review and the effect of the change measured and reported on. Unfortunately, as we have only been at our clinic for 3 days, we have not yet had time to implement a clinical audit at our facility in order to have specific examples to be able to feedback on this group, but we would have liked to do so. There's also no available data as to when the last clinical audit was performed. Claire will now be taking over, speaking to monitoring and evaluation.
So South Africa introduced the government-wide monitoring and evaluation framework, or otherwise known as M&E, in 2011, I beg your pardon. The framework gained greater commitment from the government after the general elections in 2009. In support of government's commitment to increase these evaluations, Cabinet even approved a national evaluation policy framework in November 2011. The NEPF provided the basis for the National Evaluation System, otherwise known as the NES, which is a system of evaluation across all levels of government. Since its promulgation in 2011, the National Evaluation Policy Framework and the resultant NES has been housed in the Department of Planning, Monitoring and Evaluation, which is directly overseen by the Presidency. Accordingly, we see that M&E is important to our presidency, to the most senior leadership in our country. We also see that the NES is well integrated into the national planning process, and evidence from completed evaluations informs cabinet level policy and decision making. As a result of M&E, many evaluations have resulted in significant changes to the programs or policies evaluated. Thirdly, we see that the whole of government approach has led to better understanding amongst departments of how their work impacts other departments, and greater coordination between departments and across the government in general. So across national, provincial, and local government, as well as interdepartmental. So we've moved away from this business of working in silos and rather in a more integrated and cohesive approach. So monitoring. Monitoring can be defined as a process that involves collecting, analyzing, and reporting data on the inputs, activities, outputs, outcomes, and impacts, as well as external factors in a way that supports effective management. management. Monitoring aims to provide managers, decision makers, and other stakeholders with regular feedback on progress in their implementation and results, as well as early indicators of problems that need to be corrected. So monitoring usually reports on the actual performance against what was planned or expected. In comparison, evaluation can be defined as a time-bound and periodic exercise. It's defined as a systematic collection and objective analysis of evidence on public policies, programs, projects, functions, and organizations to assess issues such as relevance, performance, that's effectiveness and efficiency, value for money, impact, sustainability, and to recommend ways forward. So what is the difference between monitoring and evaluation? Monitoring asks, what are we doing? Whereas evaluation asks, what have we achieved? So why do we evaluate? Firstly, well, the reasons for these are fourfold. Firstly, it's to improve our performance. That is evaluation for learning. This aims to provide feedback to program managers. Questions that could be asked was this the right intervention for the stated objective? Was it relevant? Was it fit for purpose? Was it the right mix of inputs, outputs? Was it the most efficient and effective way to achieve the objective? Secondly, for decision-making and policymakers, for planners and finance departments, they need to be able to judge the merit or worth of an intervention. As we know, everything in this country and universally is dependent on having a budget to support that project. So we then have to ask, is the intervention, be it a policy, a plan, a program, or project, successful? Is it meeting its goals and objectives? Is it impacting on the lives of the intended beneficiaries? And is that intervention impacting differentially on the different sectors of the population? Are there unintended consequences? And then is it worth expanding or is it worth closing this project? Thirdly, we evaluate for improving accountability. Where is public spending going? Is the spending making a difference and is it providing value for money? Again, we have to ask the question with the limited fiscus we have, how is this money being spent? And then lastly, we evaluate to generate knowledge, that is for research. So we're asking to increase knowledge about what works and what does not work with regards to public policy or program, which allow governments to build an evidence base for future policy development. As we know, we practice evidence-based medicine, and from a policy and planning process, we also want to be evidence-based in our approach. In summary, monitoring asks whether the things we planned are being done right, while evaluation is asking, are we doing the right things? Are we effective, efficient, and providing value for money, and how can we do it better? The policy framework for the government-wide monitoring and evaluation system has the following 7 guiding principles for monitoring and evaluation. Firstly, that evaluation should be development-orientated and should address key development priorities of government and of its citizens. Secondly, evaluation should be undertaken ethically and with integrity. That's important. Thirdly, the evaluation should be utilization-orientated. Fourthly, the evaluation methods should be sound. So there needs to be a very strong research basis to the methods that we use and nothing willy-nilly. Fifthly, the evaluation should advance government's transparency and accountability. Number 6, it should be undertaken in a way which is inclusive and participatory. And then lastly, evaluation should promote learning. There are different types of evaluations. I'm not going to go into all of the details of each one, but I'll just speak to them briefly. There's diagnostic evaluation. This usually happens at key points prior to the design or planning process. There's design evaluation. This is usually after an intervention has been designed in its first year and possibly later. And here we're looking to analyze the theory of change, the inner logic and consistency of the program, either before the program starts or during its implementation, to see whether the theory of change appears to be working. There's implementation evaluation. This can happen once or several times during the intervention, and it aims to evaluate whether an intervention's operational mechanisms support the achievement of the objectives or not, and to understand why. There's impact evaluation. Here we're looking, it's designed early on and it's implemented at the baseline early, as well as at key stages, for example, 3 or 5 years into the program. And here we're seeking to measure changes in outcomes and the well-being of the target population that are attributable to a specific intervention. Economic evaluation can be done at any point in the program, and this is to consider whether the costs of a policy or program have been outweighed by the benefits. And then lastly, there's evaluation synthesis. this is where we're synthesizing the results of a range of evaluations to generalize findings across government. For example, a function such as supply chain management, which is an area gross with irregularities at times, a sector or cross-cutting issues such as capacity. And this is usually done after a number of evaluations have completed. So you see this lovely diagram that we found in our research, which looks ultimately to the ultimate goal of impact and employs these different types of evaluations to see, is this intervention, what is the impact that this intervention is having on the population at large? So in looking at how we monitor and evaluate in the health setting, we came across these parts of the audit, which, as Lindsay mentioned, we've only recently arrived at Discovery's clinic, and so we weren't able to really do much research into when was the last time the audit was done, and even tried to do an audit. But there's a lot of information with regards to performing the monitoring. I'm sure many of us are familiar with the tick register, which we see in each of our in each of our rooms at our clinics. And sorry, I'm not quite sure what's happened here. There's a tick register that's in each of our rooms at our clinics, and we know that there's an ongoing monitoring. But the question that we asked ourselves as a group is, with all the monitoring that we do, how does that information feed back to us in terms of the evaluation? And that's the question that we were left with, and maybe we can have as a discussion, is that it appears that we're doing the monitoring part of the process really well, but the evaluation and the critique and then deciding what is the impact of our monitoring, that seems to not be done very well in the healthcare setting. And I would say even across other government departments, we're not doing as well of a job of evaluating our interventions and what impact they are causing on our society at large. It appears, Prof, that our last slide might have fallen off with our references, but that brings us to the end of our presentation. Prof?
Sorry, everyone. That's fine. Thank you. I'm trying to get myself sorted out in between, so apologies if I'm not paying attention. Thank you. That was a useful overview of clinical governance. I think there are groups of you all that have already been involved in some sort of audit. Anybody would like to share their experience with the audit? I think there was work being done around pap smears and chronic care. I'm not sure to what extent you'll have been engaged, but a little bit of sharing of some of your sense of what's working, what's not. Anybody would like to volunteer that information? You can unmute yourself if you need, or pick up your hand. All right. I see nobody's willing to share. I'm not sure that it has gone very far, but let's leave it at that. You know, the key thing is for you to learn how to access data where data is available. I'm not sure that you'll have a chance to talk to some of the family physicians, but the DHIS provides some information. Some of the challenges are the sort of the strength of the data collection process. So, for example, in pap smears, there was a process to say, you know, why is that not done? Are the figures right? And if they are representative of the low numbers currently there, what are the difficulties around doing it? It's also the case with chronic care as a clinical problem, a major issue. There we had looked at a tool that would be possible to, and there, you know, one has to get clarity about the guidelines. For example, diabetic care, where we looked at, one needs to be careful what guidelines you're using, and then to look at, you know, assessing the quality of care, and then to put in some interventions and then look at how you can improve it. Clinical governance, in a way, is not just to measure what's happening, both whether it's, you know, M&E, in other words, measuring what's happening or what the outcomes are, is to make a difference as well. So often quality improvement projects are part of that. And the key challenge in setting about quality improvement is the difficulty of systems broadly and staff and the challenges of culture, etc. So it's a lot more complex. Clinical governance is is an important element, and I think wherever you go in the world, you'll find that concept emerging as a way to hold clinical activity to account. Well, thank you to the team, Claire and others. Well done, and to both of you all for presenting useful stuff. And I do apologize for the difficulties I've experienced. And let's leave it for next week. I need to go and get my internet fixed up. So let me just part. So everyone, any questions? If there are none, we can end here. Thank you all. We'll see you all next week. Take care, everyone. And